Hello, class. Now we are going to talk about delegation. Here are your objectives for part 4 of Module 1. Delegation in nursing is going to follow the hierarchy of the nursing practice, and it is going to involve an RN assigning tasks to other healthcare professionals, such as the LPN or the unlicensed assisted personnel. And while the nurse is assigning tasks, they are still maintaining all accountability. Therefore, it is important that the RN ensure that the task is within the delegatee's scope of practice and that they are competent to perform it. And nurses should adhere to the 5 rights of delegation when deciding whether a task should be delegated and who to delegate it to. The right task. Is this task within the delegatee's scope of practice? Are they competent to do so? The right circumstances. The patient care setting and resources. Are they appropriate for this type of delegation? The right person. Is the delegatee competent to perform this task? Right communication. The nurse should provide clear and concise explanation of the task or activity, including limits and expectations. The right supervision. The RN should appropriately monitor, evaluate, intervene, and provide feedback on the delegation process as needed. In general, it is okay to delegate tasks for stable patients that are within the worker's job description or scope of practice, and that you're able to teach and supervise. And it's important that you have a plan on how to monitor the delegatee and their interventions. Generally, we avoid delegation when the task is going to involve thinking, complex judgments or assessments. If there is an unpredictable outcome and there's an increased risk of harm. For example, if a patient has just had a stroke and is altered, it wouldn't be appropriate to delegate that swallowing study to the LPN or delegate feeding that patient for the first time to the LPN. Remember, delegation is the transfer of responsibility of a task, but not the transfer of accountability. So it is very important that you and the delegatee have open ended two-way communication. It is important that you think of their individual competence level and not assign them something that is out of their scope or beyond their competence. And it is also the delegatee's responsibility to avoid accepting tasks that are out of their scope or their competence level. Delegation is such an important part of nursing because it's going to help manage the RN's workload. It allows nurses to prioritize and manage their time more effectively. It's going to improve efficiency. It's going to facilitate that delivery of care by utilizing the skills of the entire team. It's going to enhance patient care because it's going to ensure that patients receive timely and appropriate care. And it's going to promote professional development because it's going to allow for skill development and increased confidence among the team members as long as delegation is being done appropriately. RNs may delegate another task to another RN. And when they do this, they just need to ensure that the RN is competent in the task that they are doing. Because RNs can teach, evaluate, they can give IV medications. However, Certain RNs are going to be skilled in certain areas where others may not be. For example, I'm an ICU nurse. It wouldn't be appropriate to delegate me to listening to fetal heart tones in the mother baby unit. It would be much more appropriate to delegate me to give IV blood pressure medication to a crashing patient. Does that make any sense? RNs can also delegate to the LPN, and we generally give the LPN chronic predictable cases, patients that are stable, and we generally want to do routine procedures. You know, LPNs cannot do admission assessments and they cannot teach. They can only reinforce the teaching of the RN. And for our unlicensed personnel, they can do routine procedures such as activities of daily living on a stable patient. Remember, when delegating tasks to an unlicensed assistive personnel, remember they are not qualified to assess, evaluate, or teach. So it's important to just assign them routine tasks, such as getting vital signs, measuring and recording I's and O's, patient transfer and ambulation if the patient is stable, postmortem care, bathing, feeding if the patient is not at high risk for aspiration. And the LPN is allowed to reassess or re-educate once the RN has done so. And they can do routine tasks such as trach care and suctioning, but on a brand new fresh trach, it probably wouldn't be ideally to delegate that to an LPN. Remember, they should be chronic, predictable patients. Sometimes it is very clear cut whether a task should be delegated to an unlicensed assistive personnel or not. However, other times it's not as clear cut, and there are clinical decision making tools that we can utilize when we're unsure if a task can safely be delegated to another healthcare professional. And one of these is going to be the decision making tree. And it's going to guide nurses through a series of questions to ensure that the delegated task is appropriate and safe for the specific patient and the specific situation. During routine care in the hospital, we know that sometimes delegation is not always clear and cut. Well, in a mass casualty event, there is pure chaos going around. Resources are going to be stretched thin, and delegation is going to become even more critical. But it is important to remember that the 5 rights of delegation must still be followed, and no one is allowed to work out of their own scope or competency level. So, during mass casualties, the nurse who is delegating tasks needs to be very conscious of who they are delegating what to, because again, not all nurses have the same training background, not all nurses have the same skills, and it is appropriate to best delegate tasks aligned with that RN skill set. All right, that is the end of our little chat on delegation.